5, 4. Is this your coffee? No. Your coffee?
Oh, that's mine.
I didn't misplace it already.
All right, we are live. Good evening. The time is now 6:30 p.m. I'm Chairman Mike Curry, and I'd like to welcome you to this Board of Selectmen emergency meeting to order on this 16th day of March 2020. Please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. This is a joint meeting between the Board of Selectmen and the Board of Health this evening. Thank you for joining us this evening. If you'd like to call your board to order as well, that way I can give a kind of an overview for the evening.
Great, and we can call our board to order now at 6:31.
Great, thank you. Okay, just a quick overview for this evening, and right now we are under our 25 count for the meeting, so we are adhering to many of the different protocols that not only we've instituted within Templeton, but the federal and the state protocols.
They've changed it to 10.
There was an advisement
Yeah, 20
for
minutes
10,
ago.
yeah. So just very quickly, for the posted meeting, there's the discussion for COVID-19 and then any possible action based on tonight's discussion. A little bit more in depth, I just wanted to congratulate TCTV on their first live broadcast. So we understand that there's a slight delay, but this is the first time that we've had live broadcast for Templeton TCTV, and it will record as well. So this evening, we're going to go over the Board of Selectmen opening statements, just give a quick overview of the situation. Then we'll dive into the Board of Health's presentation this evening. Then I'd like to lead a joint discussion with any possible Q&A that we may have within the room or within our audience, or if we get any feedback from our live stream. And then any Board of Health pending resolutions for this evening, and any Board of Selectmen resolutions for this evening, and that's all we had on the agenda. Let's see. There was one point I wanted to make. We'll come to that. All right. Just for our quick opening statement, I wanted to give a quick recap of the response thus far. Although COVID-19 or the coronavirus has less transmission than the typical flu virus, this pandemic novel virus is deadlier and has yet to be determined transmission qualities that force the overabundance of caution we have seen in our public leadership decision-making processes. The country and the state have declared emergencies. Furthermore, Governor Baker has made several restrictions on travel, congregation, and business patronage, some as late as 24 hours ago, Sunday evening. For a complete list of these continually expanding proclamations and public restrictions, please visit the Department of Public Health's website, our website, or dial 211 for the latest information. Templeton was in a state of pre-emergency. This can be described in two ways. First, the conditions of affected persons in our community have not warranted an emergency response. And second, our pool of resources has not yet been expended. We could consider any changes in those two conditions a trigger for the change in our emergency preparedness level. And certainly, it is why we decided to meet in emergency session this evening. That's all I have for an opening statement, unless there's any brief remarks from the Board of Selectmen.
One other place for information the governor put out at his news conference, it was about 4 o'clock. You can go to mass.gov/coronavirus and get information on there and find out. It'll links take you to here and there. I personally call that 211, and it's the wait time varies from it's busy, as you know, everybody's.
Oh, okay.
Yeah, and they acknowledge that they're working on staffing it and
Okay.
getting cleared out. But but mass.gov.
Okay, for like
is
an
another
instant
place
online
to-
resource.
Yeah, so
Okay.
instead
And
of
it's,
waiting on the phone.
if you just go on mass.gov, it's right at the top that there's a link to,
Perfect.
so.
Before I turn it over to you, Jane, if I could just, we do have a lot of participation on the line. If we could just go around and, who do we have on the line this evening? I know at least we have our,
Mike Dixon's on.
say that again, please?
Mike Dixon's on from emergency management. Rich Curtis, emergency management.
Thank you.
Jackie Cron, Community Services.
Great, thank you, Jackie. Okay, that's all we have there, but several members of the EMD team and Community Services. Great. Mrs. Crocker, thank you, if you'd like to take over.
Okay, actually Lori will be the one speaking, so.
Great.
So, as of today, oh, I'm sorry. Yes, yes, I can. Hello.
Hi.
As of this morning, we were notified that we do have one confirmed case of coronavirus within our community. That person is in quarantine, not leaving the house, being taken care of from home. And his immediate family is also doing the same thing. After being on a call today and a webinar with CDC, they had a lot of information. I know there were questions about things like, can it be food-borne? They have not been able to prove that it can be food-borne. It is still touch. Everything you can touch with your hands, your switch plates, your handles, things like that. Those are the things you really want to concentrate on cleaning and keeping up with, and still the hand washing and still hand sanitizer. They did say that this is more transmissible than the seasonal flu. However, it is less dangerous than the former SARS and MERS that we faced previously. They're still saying runny nose, sore throat, fever, headache, cough, and feeling of general unwell. They're hoping that the closing of the schools and a few other businesses will slow it down and flatten it out a little bit. Has legs. We don't really know exactly how it's going to happen. You already took care of the websites. They're still recommending that if you want up-to-date information, Mass DEP, MassGov, and CDC are the best places to go. They did state the incubation period is 2 to 14 days, with 3 to 6 days approximately of actually being sick. Their recommendation is that 72 hours after your fever breaks, if you no longer have any other symptoms, you are able to go back out into, away from being quarantined or isolated. They do not know how long the virus can live on surfaces. They're saying anywhere from hours to days based upon what the surface is made out of. So if it's a porous surface, wood versus, it's probably a longer live period there than here. But again, the cleaning with a solution of bleach and water is one of their recommended ways to kill it. They did say that your regular Lysol, all your normal Clorox wipes are working. So, and interestingly, they did talk about money handling too. They don't believe that it's any more for our treasurer dangerous for our people who are handling money than it would normally be, so.
Money, anything like money, mail, or any kind of paper passed.
Just wash your hands when you're done.
Yeah.
You know, well, credit cards, because I know within
Keypads.
yesterday's, the governor's restrictions on restaurants and things like that, he still allowed for curbside purchases, and obviously, they have to figure out, and I was gonna talk about that in a little bit, in way of established process. I mean, it's not like one established process, but they want money for the service that they're providing, so that'll be interesting to discuss that,
Yeah, pay online while you're ordering it,
right?
yeah.
Yep.
I don't know that some of our
DoorDash or-
You would
establishments
be able to do that, yeah.
would be able to
Uber
do that.
Eats, any of those kind of things. So actually, that's a great point for any of our, we don't have a whole lot of major chains or anything that
Right.
may have immediate access to those, but like Crossroads, Patriot Pizza, Baldwinville Station, they may want to invest in or get an account with any of those, because it actually may improve their safety. But that's a good point. I'm glad that came up in discussion.
So our food establishments have gotten notices with regard to doing takeout, delivery. They're still able to do all of that. Just no in-service.
Right.
And that's kind of where we're at right now.
Okay.
So, questions?
I think, one of the things that we talked about is what have we done to this point? And I think you, the board and your team have done an amazing job leading that vanguard effort of, before people could spell coronavirus, we were already attending teleconferences and otherwise. So right along with the way that emergency operations are supposed to happen, you're supposed to do prevention and awareness and planning, and I think that you guys have achieved that very well. So I very much, tip of the spear kind of stuff, I really appreciate you being able to do that. And I know there were extra hours there that the TA already authorized some overtime, so that was good.
No worries.
I just tried to figure out how I would phrase this. So, could you speak to the duration of this pandemic going forward? China started in July of last year, and they're finally starting to see a little bit of relief. And how, if we adhere to the guidelines put out, we might be, have they talked about that at all?
They haven't been able to put a number on it. What it is, and you have to consider, you flatten it out by doing the things you're doing, which hopefully decreases the amount of people who will become affected by it. It continually moves, and there's always a chance that it'll circle back. They're hoping that's not the case, but they really don't know. It has settled down a little bit in China, according to them, and kept moving this way. So,
So we're at the beginning.
Yeah.
But hopefully if we learn through China, maybe we can, because they're talking August, September, October. Just wanted to make that.
Yeah, I
Right,
think
that out
the
there.
point also is all of these measures that we are adding, oh, I'm sorry,
They
Diane.
were saying, when I was watching Dr. Faucia,
Yeah,
July or August,
Yeah.
that
they're
before we would
hoping-
see
yeah,
any
they were
real
hoping
sense
to
of
kinda
relief.
like flatten
That
out.
it's not really, we're trying to
Exactly right.
flatten it now. It's not flattening. We're trying to take every measure possible to flatten it.
right.
Like by all the steps that the president is now taking and our governors have already taken, and that we are trying to do here. That we'll hopefully, flatten it faster than some other countries have flattened it.
Right.
But that's what we're trying to accomplish right now, right, Lori? That's
Yeah,
what we're trying to do.
and they admittedly,
But there really is no real, it could be longer.
yes,
It could be, that's what Dr. Faucia is saying.
they really don't know.
But they don't know, but they're
Correct.
just, they're trying to predict.
Right.
Because people want some answers, but there's really no real answer.
Not yet. Sorry.
I know, but we're trying to, this is what we're trying to accomplish, is trying to flatten it faster than what other countries have flattened it.
And if you know, the president did say if we adhere to the guidelines and all America pulls together, then chances are we can come out on top earlier.
That's the hope.
Our medical system has also learned a lot from the other countries, so hopefully we're ahead in that step
Yeah.
as well.
I think that, you know, we receive emails every day, updates from Lori, updates from Rich, updates from Mike, about the virus and about what's going on, and we've been kept abreast of that, and it helps ease some of the tension. We know things that are coming, things that you're thinking, and that's why we're having an emergency meeting tonight. You know, we get, you know, briefings from our governor, and I think that we've really been kept abreast of changes. There are nightly briefings from Haywood Hospital that you can watch, and, you know, we've really been made aware of all the things that are happening in our communities. So you have done an amazing job, and I thank you all very much.
Thanks.
All of you. Good leadership, strong leadership.
Anything else?
No, but I definitely want you to stick around for that joint discussion and any question and answer that we may have
Sure.
from a broader sense. But I wanted to go through at least where we are in response overall within the town, and I have a bunch of prepared notes for that. And then I absolutely want to let my board members, I know on their minds is our constituents and recovery, and making sure that you know, in a moment I'll talk about vulnerable populations, and the different ways that we could kind of slice that out. There's the obvious, and then there's the not so obvious,
Right.
because there's an economic aspect to this that we may not feel very much right now, but we may. So definitely, please, if you can help or participate in that joint discussion afterwards.
Yes,
Okay, thank you.
thanks.
Okay, just want to I took some notes over the past few days about what response has been, and then what we can expect coming from the team, not just the team you see here tonight, but from the greater set of stakeholders that we've assembled for this effort. From a public health perspective, there's three priorities of effort. Really, for any emergency situation, it's number one, save lives and prevent injury. And I think that's first and foremost in our minds right now. The second thing is remove citizens from dangerous conditions or dangerous conditions from roadways and dwellings. So when I say dwellings, it's buildings. It's why we had the protocol before any of you entered the room this evening, that it was sealed, that it had been disinfected by a team with PPE and the right materials to do that. We have to lead by example. These are the same kind of prevention measures that we need to take as a community. And then that third priority of effort is restore services. You know, the other word in there is restore services and roadways. If we had any other kind of disaster, we're used to snow and ice and things like that when we come together in these situations. Now we've got a pandemic that we're looking at. So when I think restore services, it's how do we return to normal? How do we go back to meeting in public? How do we continue having corned beef dinners on Wednesday evening? 50 people signed up for that. Now, we have to cancel those kind of events. So those are the three priorities. I know probably Mr. Curtis is saying, hey, you just stole my thunder. We need to think as a team, and I want to make sure that everyone knows that the emergency management team, those are the things that they prioritize. Specifically for our community, there are supporting lines of effort, and I want to go through a few of those. The first is to secure our vulnerable populations. Again, that's going to sound like a broken record because we've already discussed how to do that. We're not shutting down services. We're curtailing some services. The library, I think, closed today. Senior services had to pull back on some of their services, but we need to secure those vulnerable populations. Second, we need to support a resilient public infrastructure. Earlier today, Mr. Terenzini, our town administrator, talked about continuity of operations or continuity of service. we have that obligation as taxpayers to make sure that we're providing a resilient support structure for not only keeping the town running, but for dealing with the emergency at the same time. Third, continue information flow to partners and the public. It is absolutely imperative that we keep our public, this is the local level. They say all politics are local. Everything happens at the local level. People can watch Channel 5, they can watch Channel 25, BZ, TCTV, all these different things. But if they're not hearing it from the people that they're paying their taxes to and have that expectation of what is my local community doing for me, then not enough is being done. So we need to keep that information flow constant and updated. Fourth is we must obtain or replenish our critical resources. In talking with Selectman Bennett over the past couple of days, we need to make sure we find avenues by which we can replenish not only our physical resources that we're expending, but our financial resources as well, and be smart about it. If we can provide relief to our vulnerable populations, both economic and medically, then we should be doing that, and at least doing the work that we can to figure out a way to use those resources. Fifth and final, for at least the supporting lines of effort, we need to plan for recovery actions, and I forgot to mention earlier in a request to the BoH, and a healthy lessons learned. By the time we get through this and we can give each other high fives without disinfecting our hands afterwards, we should be able to derive a large set of lessons learned. And I know that Carter's already started jotting down a lot of those with his stubby pencil and trying to keep track of those in his mind. Again, plan for recovery actions and lessons learned. Just to update everybody what our coordination team is, and who might not be just foremost in the front right now. Right now, as I said, the tip of the spear, the vanguard effort is the Board of Health with Director Witta and Chairman Crocker. This morning we met with Dr. Casavant and Chairwoman Hughes with the Narragansett Regional School District, who has that monumental task of closing schools until April 7th. Disinfecting them, feeding the population that needs to still be fed, and listening to his plan this morning, and then the multitude of ideas for how do you continue educating the children or your children at home. Emergency services, which includes Chief Bennett, Chief Dickey, and Director Curtis. And under Director Curtis, also he has the Community Emergency Response Team, or the CERT team, which we spoke in an earlier teleconference today, lots of teleconferences, about how we can best use that population to try and fill the gaps of some of the other areas that may feel stressed during this time. So again, thank you to Chief Bennett and Chief Dickey for already taking a lot of preventative measures for their own first responders. And Chief Dickey's with us this evening. Our DPW Director Skozik, has also been of vital importance with that. This disinfection, all these facility processes that we have, he is our point man in dealing with facilities. Director Prime, she's on the telephone with us this evening with Community Services. I know one of her staff, Sheila Pelletier, talked about point of service, or I forget the term that she used, but the people, the storefronts of our operation, making sure that Director Prime has everything that she needs in order to be able to deal with those vulnerable populations. You can't forget our community-based organizations and our volunteer organizations. I wish I had an entire exhaustive list of them this evening. There could be few, there could be many. But I know I've seen at least the Friends of Templeton elders out there making a lot of Facebook posts and discussing alternatives, what's open, what's not open, what they should be doing. So I certainly applaud their efforts, and any other community-based organization that I may have missed. But they are a vital part of our community that can help the normal infrastructure that we have. Just a quick note, although not a primary stakeholder for these proceedings, and we haven't sought to coordinate with them, but we've got the general manager, John Driscoll, out there from the Templeton Municipal Light and Water Plant. Should we feel the need, I'm sure that we'll have some outreach to the light and water plant in case there are any issues, especially when we start talking about any kind of fee relief or any kind of assistance to make sure that people can get through this. Vulnerable populations, just very quickly, in my mind, includes senior citizens, people living in communal settings, immunocompromised people, which means health conditions that severely suppress an immune response, or people that may be taking medication that prohibit that immune response. So if you hadn't thought about those kind of people out there, start to think now. They may need a phone call, make sure that they're okay. They may need extra assistance in trying to get through this crisis that we mentioned a moment ago. Is not going to be minutes and hours and days. It's likely to be weeks and months. Children, I know that there's been discussion that they are not, when you take a look at numbers, you don't see children at the top of the pile, but when you talk about transmission in large groups, they're the first group that I think of that congregates together, and that's why we've taken that, Dr. Casavant and Chairman Hughes has taken the approach that they have. So definitely we should include those in our vulnerable populations. And then lastly, but certainly not leastly, the first responders, healthcare workers, in our community volunteers. And I stress community volunteers. We talked about the drive-by meal plan at the school and how they're going to achieve that by this brown bag lunch and distributing breakfast and lunch at the same time. At some point, they wind up having to take on volunteers to do that. And I know it's our interest to make sure that we protect those vulnerable populations as well. The more contact you come in to people with, the more chance you have to either contract or transmit this virus. Just a couple more points before we go into a joint discussion. Our continuity of operations. Closures are the best way to protect against exposure, but we must continue a degree in effectiveness of our town operations. And in doing so, we have to support our community public and private infrastructure. That's a mouthful. We have our public infrastructure, which is the majority of the people that we're talking about tonight, but also our private infrastructure, people that have to carry on business, especially if it's a retail business. So I'd urge people to get on social media, take a look at how people are advocating and advertising all the different organizations, the pride that we have in our community, buying gift cards. There's a host of different ways that we can achieve this, but certainly reach out and take a look at your public and your private industry that we have here. We know that right now we have to consider an alternate way of doing business. Earlier this morning, town administrator talked about there are several methods to pay town bills. There's UniPay, Gold online, there's different ways to pay bills. I'm struggling to think of some of the other vendors that we have that do that. But consider, instead of going and putting cash in hand, swipe your credit card at home, use a PayPal account, try and figure out a way to do business alternatively. If you can update your dog tags and pay your dog licenses online and do things remotely, please do so. But certainly think of if you haven't yet got the app to deposit checks through your phone, grab somebody in your household or look up a YouTube tutorial on how you can do that. But we know that we have to do an alternate means of doing business. Not all of our community has access to the same technology, and we have to remember that. We just can't say go to the website. We have to figure out a way to reach each of our community members. Some of them may not be as technically savvy as we are this evening by streaming through LiveTube, our emergency meeting. A moment ago, I talked about, we've had some conversations about fee waivers and relief. In the coming days and weeks, we will certainly have that discussion on a way forward if that becomes an issue for our constituents. We also are very interested in protecting our own workforce and infrastructure. I know that there will be some posts about Town Hall. I know many of our local communities our surrounding communities have already closed their town halls and otherwise different facilities. We may be following suit as we have to maintain our own workforce as well, especially in some of the offices where we're only one or two people deep. And finally, just with our continuity of operations, we need to stress our resilient staff decisions. And by that, I mean, and Chief Dickey brought this up in a meeting earlier today, decisions for vacation. If you have a staff member that's looking to go on a princess cruise, you might want to have a discussion with them. Might not be a great time to take a cruise right now. Appropriate manning levels, whether you need additional personnel or you could reduce your footprint at work. Cross-leveling personnel. A moment ago we talked about the CERT team helping out. That's a discussion that we'll continue to have. And then ultimately, if we so warrant any closures. But really that's designed to make resilient staff decisions. Two quick last things. Organization, it's the same as you would expect, except which you may expect this evening. We may have some emergency declarations. We'll be instituting our, I just blanked on ICS, Integrated Command Structure.
Yeah,
Incident Command Structure, thank you very much, I blanked on it. We may be instituting different organization or different decision-making trees. Once we make those declarations, we want to make sure that we're informing the public of what we are doing and how we are doing it. Staffing may cause some changes as well with organization, but you can at least rest assured that we are constantly in communication, whether it's by face-to-face communications, teleconferences, or text, and the multitude of communication choices that we have here. Finally, on that last note, our communication plan. Everybody should know our official source of information is our website, www.templetonma.gov. That is www.templetonma.gov. We've gone through a lot to make sure that website is a good place, a great place for you to get information, and it works on multiple platforms. Whether you have a Mac, a PC, a smartphone, an iPhone, or otherwise, you can go to that website and easily get to the information. I constantly test the system, and anybody can give their 2 cents or any kind of observations on that. But we have a great place for you to go in our website for public information, and updated information. The selectmen's number is 894-2755. That's 978-894-2755. Our social media website is the entire facebook.com web address with /Town of Templeton, all one word. Again, that is facebook.com / you're looking at me on the camera, that's a / Town of Templeton, all one word. Code Red. I worked a little bit on Code Red this evening, and I'll be working with or ask some help with Code Red after the meeting. I spoke with them this evening because I've registered for Code Red. I have a login. I forgot it. I called them and I asked them, is there another way people can call up other than clicking on that icon on the lower left-hand screen of our website? There absolutely is. Take down this number, 866-939-0911. That is 866-939-0911. You can call up, tell them that you're with Town of Templeton or the Town of Templeton Police Department account, and they'll actually walk you through signing up for a Code Red account. I will be speaking with, I believe that Chief Dickey is Chief Bennett, the primary for Code Red. I'll be speaking with Chief Bennett at some point because there is an unactivated, no-cost addition where you can actually have a cell phone and text the number 99411 with a keyword that we would decide. A good one would be Templeton PD, all one word, and you can actually automatically sign up for those Code Red alerts. So that's some, a little bit more information that we have on the website. I think we could probably do some updates. But again, pushing out as much information as we can. These are all the different ways that you can get updates on what your community's doing during this crisis. Are there any questions of me? I know that was a lot right now. Yes?
Just a comment on the website, on the very homepage is a tab, social media. All
That's
the
right.
Facebook pages are on there. People can click on it and it goes right to it.
Okay. Now Holly's not on a microphone right now, but if you didn't catch that, for the social media sites, if you go onto the town website, right in the middle, there's a tab for current news or updated news. If you look closely, there's another tab for all the social media. You click on that tab and you'll see all of our social media, Veteran Services, the Town of Templeton official site, any other site that is an official site and that's, that we put information out is available through that link. Thank you, Holly, appreciate that. Are there any questions? Well, actually, let's just roll into a joint discussion and any Q&A that we may have. Mr. Terenzini.
Could I walk through some of the highlights of this morning's team
Absolutely.
meeting? So the library is closed tomorrow, and upon, should you declare a state of emergency tonight, it is my intent to close all town offices to the general public effective Wednesday morning. Why all town offices? Municipal light plant's already closed. It is important that there be consistency. I know that, maybe somebody could walk in, but to one office, they can't get too far, let's say, but I think it's important that there be consistency. All staff will be expected to still report to work. We still have a business to run as we manage our response to this incident.
Those of us on the phone can't hear what Carter's saying.
I'm sorry, what?
They can't hear what you're saying. That's okay.
Oh.
I'll bring the phone
Okay.
over. So to recap, the library's closed and
So
it's Carter's intention to close all town offices as of Wednesday.
Over tomorrow, we will be preparing directives to all staff. And all board meetings that are our boards have been canceled through the close of business Friday. We need to discuss alternate planning for the budget. And we will distribute means by which committees may meet in virtual reality, telephone conference call, and the like. No public meeting would be open, with the exception of this one tonight, due to the gravity of it and our desire to get it public, would be open to the general public. There's nothing coming up on the agendas over the next couple of weeks that require public hearings or in-person presentations. The staff has been, and this will be reinforced tomorrow, that all business that can be done through the use of technology. There were interviews scheduled for Thursday. Those will become phone interviews. There's a presentation being made by an insurance company. They can send one representative, or they can do it in virtual time if they want. So first order of business tomorrow will be declaring, preparing this memorandum for the public. Everything's closed to you, but here's how you can do business. Here's how you can pay your bills. Here's how we're going to continue to conduct business. And if you need something, Veterans Services Officer, for instance, we'll figure out how to get something done for people by appointment. The school district is distributing, if it did not go out today, tomorrow morning, a survey to all of the families to try to determine who might be in need of food. We don't want to forget that this has more than a social impact in terms of what we're doing here tonight. We do have children that rely upon the schools for a free lunch or a reduced price lunch, or simply good nutrition that day. This can be a major source, and the superintendent has been working with his staff and in cooperation with the Haywood Hospital's Food Bank to prepare the number of lunches that are needed. These will be done on a come-get-them basis. However, part of that survey will be, do you perhaps not have transportation? Perhaps they're older kids, mom and dad work in a hospital, or they're on a front line, they're police or they're fire. They may not be able to take the time off because we're getting stressed on both sides. We get stressed upon the demands upon our personnel, and then if those personnel are under stress and are not available, that simply accelerates it. So we have offered with our drivers the MART buses, if needed, to transport those meals should someone not be able to get there to pick it up for their children. Jackie will be doing a similar survey, if you will, trying to sort out who beyond the Meals on Wheels program might be food insecure and might need some assistance. With the regional school district, they have agreed that should they have supplies, personal hand sanitizer was one thing that we talked about today. Also, the school district has fogging machines, which actually they've used for flu, they've used for norovirus, they've used in the past, fogs their buildings. They've agreed within the limits of the supplies that they have.
Right.
One of the things we have going for us is they're closed longer. Well, we're still trying to, the chief still has an ambulance who runs every day. We have cruisers that run every day, and we will have building spaces. So within the limits of the supplies they may have, and it's not just today's supply. We need to look at when might they reasonably get replenished. Is it the N95 mask?
N95 mask.
The N95 mask, which is the one that actually is needed in this case, is actually made in China. So a lot of these supply chains, it's not just the disease, but a lot of the supply chain comes out of that country as well. So to the extent they can share those supplies with us and still be in a safe position, they have agreed to do that. The chief will coordinate needs that he has directly through the head nurse, and Bob Sosik will coordinate his needs directly through the buildings and grounds fellow, Rick Moulton, for the school district. Communications is important. We'll be stressing that a lot tomorrow, and I want to take one more opportunity to pile on what the chairman said. Please remember, if you have converted your phone to VoIP, Voice over Internet Protocol, if you have gotten a cell phone, we don't have those numbers in our database unless you go in and register them, and we'll get some added information on how to do that. The staff will be issued directions on money and mail handling. It's really straightforward. Wash your hands before you do it. Try to do it all at once as a single batch. Wash your hands afterwards. The single simplest thing when we're asked, what can you do? It's observe the normal and ordinary personal sanitation practices that people should be practicing all along. Again, we'll have more information, but fire department chief believes no need to curtail burning permits at this point, but as of Wednesday morning, they will all move online or by appointment. The fire chief has instituted a pre-screening process if somebody needs an inspection, smoke detectors for home sales, the new furnace that got installed, that kind of thing. There will be a call to that household first. How's it going?
Yeah.
Whatever decision-making tree that he does, because we have to recognize his houses, if they have purchase and sales on them and closing dates, they still need to close. And if there is someone who's put a new boiler in, they still need, I can't lose sight of the fact that we still have a business we're running here. I think that the police chief has instituted orders of the day to try to, make it clear to his people, no food brought in from the outside that's not your own personal prepared food. No congregating after your shift is done. Thank you very much. Get out. Less interaction on the motor violations. Those kinds of things. I think that a declaration at this point would be appropriate to put behind me the authority from the board to take those steps that many of them I could have just done on my own. But frankly, we didn't think we were there till about 5 o'clock last night. And in particular with the news this morning that we now have one confirmed case here.
I got, we had talked about using the term low risk. Last week this time, we could have still gone with low risk
Right.
based on those assessment factors. But certainly that has changed within the last few days in terms of transmission, changes in other situations within the state. We are definitely not in a low risk environment.
And under the incident command system, let me add two last things. One, it's obvious to me that after this incident, you need to do a complete and thorough after-action review, after-action report, and that the community needs to expand its training of its personnel on ICS, at least the 2 basic modules that will explain to the staff what ICS, how it works, and why nobody gets to go do anything on their own, but there will be a single administrative command and control. And on the public information side, we would ask, Mr. Chairman, that you consider taking on the public information officer role so that it's coming from the chair of the board. And we will reinforce to all departments that nothing is to be issued as official town statements unless it's either been pre-approved by the public information officer or issued by the public information officer. Because one of the things that I've observed throughout this event is different people, not in this community, in our governmental structure, more at the federal level, stating things that are inaccurate, untrue, or directly contradictory of science or what others say. And that's a challenge, and I would hope that that is a test we would not fail here in this community. So that's everything we've done. As of today, there will be a all-department team meeting tomorrow morning for me to, so we can help put that poster together. We can make sure everybody's on the same page. Primary staff for our purposes is obviously Lori, police, fire, Bob with buildings and grounds, a contact from the regional school district, Jackie with community services, and EMD. Well, all of our other departments, of course, administration and finance, and some of the others are important. Those will be the primary people who I would consider to be the team.
Yeah. And until, were you finished?
I am.
I was gonna ask Lori for help with getting my phone, but why would I ask her to pick up my smartphone? See, or observing good procedures.
I don't even know how to hold
No,
those.
let's see you pick it up. You just probably ruined it. So, I know that Rich Curtis said he's on his way imminently, but please know that Mike Dixon is gonna be your guy on the ground, working jointly. So just as far as stakeholders go, there's 2 of them
Yes.
that you can deal with, okay? Thank you, Mr. Terenzini. What I'd like to do now is have any joint discussion items or any Q&A. I know one of the things that we thought was a possibility with a live stream was that we may generate some questions I don't know how they would come to us unless someone was watching social media or Sean, who's actually operating our live stream right now remotely, winds up saying the same, we're getting the same question consistently. So if that comes through, Sean, if you want to share with any questions, I don't even know if you have comments turned on our live section, but please, let's have this open discussion, and then I'd like to follow up with any
I'm trying to find it on here.
yeah, with any remarks or any declarations that the Board of Health may make, or if they're gonna just defer to the Board of Selectmen, however we want to accomplish that this evening. Yes,
So my question is, once we declare a state of emergency, and how does it position us for state aid in the future? You notice Charlie Baker declared a state of emergency last week for the federal level. I know the town of Orange
appear to be.
did it in Fitchburg. Do we have a number,
doesn't
or
appear to
how
be.
does that work?
Any questions?
okay, none yet?
No.
Okay,
So how does that work, putting Templeton in a position of financial aid in the future if we do declare a state of emergency tonight?
Does Rich want to try to take that?
Rich, did you hear that question? Do you think you could provide a succinct answer?
Yes, first off, we do not have to be in a state of emergency to be eligible for funding. A state of emergency basically means that we've exceeded our resources and need some help, or we need to possibly move money around quicker than the normal procedures of day-to-day working. But as far as being a state of emergency, the only thing that really does for us is allows us to expedite our work. For the funding, it has nothing to do with it.
Thank you, well
Nothing to do
said.
with funding, but preemptive in order to expedite, what
Right,
type
it's
of
like
work?
it's like an aligned, a synchronized declaration that number one says to your community, we're in a state of emergency and we're gonna take special precautions and otherwise. Is it, as Rich said, it can be for an example, if we've been in a snowstorm in the past, Phillipston may have declared a state of emergency where we have not, but we have still requested reimbursement for any storm-related items, especially if other state or state declarations have been made. So it's not, it does not allow, doesn't open up floodgates of dollars coming in, is what he's saying. One question that we're getting from from our live stream is, what can we do as residents to help with the town? I'd like to punt to the Board of Health, or if you have any ideas, what can the residents do?
Do I have to come forward?
You do.
Yes.
It would help, that way they can,
Okay.
So what we would ask is that you really just follow the instructions that are given by the CDC. And if I might add, I'm not sure really what the run on the grocery stores are, but check on your elderly neighbors. They're gonna be afraid of going into the stores, and maybe if you can pick something up for them while you're there. We don't need to hoard things at this point in time. Take care of each other, wash your hands, cough into your elbow. It's the same thing. Look at the ways, if somebody in your house is not feeling well, they give you instructions on the CDC website, how to wash your bedclothes, how to, if somebody's been sick, throw away their toothbrush, give them a new one. So it's simple things like that that will help the community. If somebody's sick, stay home. Don't go out into the public.
right? A lot of what we talked about flattening that curve, we get through this quicker by people adhering to the public health limitations that we're imposing on ourselves. We have to be one team, one fight in
Right.
this. Mr. Terenzini?
I'm sorry, I didn't mean to jump ahead of Terry.
Oh.
Is the food pantry open, and would you suggest more donations to the food pantry if it is open? Or would that be hoarding?
No, that's definitely not hoarding, but I don't have the answer to that question on the food pantry. I never even thought of that.
Director Prime is
I'm
on the
sorry.
line this evening.
Jackie?
Yeah, hi. The food pantry is currently only open on Tuesday mornings. My thought was that either we expand the open hours to the public, or in conjunction with the phone call system we're hoping to initiate with some isolated seniors, that part of that phone call is a question about whether that person may need some food that we could, package up from the food pantry and deliver to them. There's lots of food there. There were just 2 churches in town that had sort of a friendly competition of who could raise and donate the most food. So the food pantry is well stocked. It's just a matter of how we decide to make that available, whether it's sort of we open the doors more hours throughout the week, or we target the people that we will be calling, specifically asking if they need help.
More of like an appointment-based system.
Right.
So would you?
Right, and yeah.
One of the things I want to caution against tonight is we sent some folks this morning away with some homework. The school superintendent went away
Sorry,
with
I
what?
can't hear Carter.
Sorry about
That's
that.
okay. I'll get my exercise in today.
Get your steps for sure. What I was saying, Jackie, is I want to be very careful here tonight about what we say specific plans might be, because this morning we sent folks away. They either had said what their homework was going to be over the next 24, 36 hours, and we're still in the midst of doing that. So until tomorrow, when the staff convenes and makes some of these decisions, it's really difficult to say. So in terms of what can you do to help the town, I would put those into 2 buckets. What can you do to help yourself and your fellow citizens? Those are all of the personal sanitary practices and good common sense. If you don't feel well, don't go to work. Yes, we love your dedication to your job, but you're not doing anybody any good, yourself or someone else, if you go to work, if you are ill, and if they become ill because you were there. So we've said to all of our employees, if you're not feeling well, you have leave time, take it. We have advanced to any employee that does not have leave time, sufficient leave time, which we'll sort out later when we know what the federal legislation is, because that right now it's only news reports. We don't know what it is. So in terms of that, if you know of a family that has food insecurity issues, or if you know of an elder that has food insecurity issues, call the senior center, call the school department, leave us with that information, and try to watch TCTV and watch the webpage for all of these kinds of things as we make these announcements. I will say that if you know of a elder person, the best way to check on them, quite frankly, is going to be by a note under the door or a telephone call. This is not the time to go visiting grandma and give her a big hug. She is highly susceptible to this disease, and we don't know how it's transmitted, and people can carry it for several days before they become symptomatic. So there are a lot of good things you can do. Now, how can people help the town of Templeton as a organization? Number one, please have patience. The doors will be closed effective Wednesday morning, should you make this declaration, and not reopen until Monday, April 6th. That said, we are here to try to help you in every way we can. If you need a birth certificate, call the town clerk's office, and she will walk you through how to find it on the webpage and pay for it. If you have a question about your tax bill, call us. If you need a burn permit, they're online. Call the fire department, leave a message. Yes, it may be a few hours before somebody gets back to you, but we want to try to continue to service our citizens in every single way possible. So how can people help the town of Templeton as an organization? Have some patience with us, please, and learn everything there is to learn on our website and make it your primary means of obtaining the things that you need for your daily life.
Well said, Carter.
A resident is asking if there's any, I don't know if this is a HIPAA violation or not, but if there's any more information that you can give about the confirmed case, like were they out of the country or?
They were not. But the only thing I can tell you is that it's an ongoing investigation through our nurse practitioner who does all of our disease follow-up, and they will take care of everything through that office.
Okay, all right, thank you very much.
And contact tracing has begun.
Yes.
Contact who?
Do you want to explain how that works, please, Laura?
So what happens is this nurse that takes care of us actually contacts the person, and they do a trace back where they were, who were they in contact with, was their family with them, it just goes all the way back to try and figure out exactly where it happened.
Wow.
And then that way they can notify anybody that needs to be notified, whether they need to be quarantined or not.
Mhm.
So far, they've been working on that all day today.
And that's, we obtain that professional advice and assistance through our membership in?
Montechusett, sure.
It's in the budget book. This is a chance to plug for one of your budget items.
No, it's not, and I went completely blank, I'm sorry, everybody.
The
It's,
MBNA?
MPHN.
FPHN.
Yep. That's
Well done.
that's a big partner for us.
Yes.
It really is, it really is.
Okay, so
Don't take it.
they were just asking, so it's an investigation that goes on.
Correct. With any communicable disease, that is the protocol that's followed.
Okay, all right, thank you.
Welcome. Anybody else?
Okay, we've got a couple, or at least one concern and one question. Volunteers for the food pantry. Carter, I would think that if we have a volunteer situation, that would be handled through Jackie Prime. Okay.
After discussions tomorrow, yes.
I want to make sure that Jackie, we have a pretty good phone connection with you. Could you give your office phone number out?
Sure, it's 978-939-5582.
5582.
Right.
Okay, perfect.
By the way, if I might, Mr. Chairman, as we talk about the importance of the web, we have a confluence of events where our internet will be down for about 90 minutes tomorrow on a pre-planned change of our complete server. We thought about canceling it, but frankly, we need to get that done because we need to get our phone service restored to full working order. So the choice was to defer it or to endure it.
All right,
And
thank
we've made a choice to endure it because we need to get the phone systems fully functioning as well.
Okay. And I'll reiterate that just for those on the phone. So tomorrow, we have a confluence of events for IT upgrades, so about 90 minutes. Tomorrow, we'll be doing server switch outs and switchovers. Do you have an expected time for that? Morning, evening?
8 plus or minus through 9:30 plus or minus, and that will affect only town hall.
Okay.
So if you're trying to get through to the town clerk, one of the offices in town hall, there will be a brief period of time when you can't.
Okay.
But as I said, the choice was to push it off or endure it, and we think we've made the right judgment call.
and I know that our information is redundant as I see it right now. A lot of the information gets posted one place, it goes to Facebook or otherwise. So I think that is another good thing. Let's remember that. Let's not remember the bad things for the AR. Let's remember the good things too. So just reiterate for those who couldn't hear Carter, it's going to be early office hours that you'll experience that 90-minute-ish outage. Just a couple of, one more concern, and Jackie, this one's for you. Just there is a concern for the level of services through the Council on Aging and the Senior Center in terms of the variety of different services that we use, and to quickly switch to telephone only could be not so much break our service back, but just as a thing to watchful for. So to that citizen
Right.
who's, go ahead.
We have a recommendation that no shine appointments are made going forward. I'm sure that Gail would make herself available via phone to anyone who has specific questions. Sue LaJoy has stated that she will be available at the center to field any phone calls regarding, the SNAP benefits. Meals on Wheels, Gamma will be closing as of Wednesday. So that kind of shifts the transportation piece back to Templeton. We have talked to two of our MART drivers. They expect to continue with any them either ride services or Meals on Wheels. MOC has said that they have no intention of closing, and they will be trying their best to provide the meals throughout this crisis. So that's kind of a see how it goes type of thing. I think that we do have a couple of drivers who can pinch hit the delivery for the meals as they did, last month, as early as last month. So while Gamma is closed.
Let me do this and try.
Okay. They should be able to hear you if you go to the center table.
So just a couple of quick add-ons. The school district said that should something happen to the mock program where they shut down, that they would provide meals along the lines of what they're making. They have the material they're working with in their capacity, and we would then just shift from delivering Meals on Wheels from MOC to Meals on Wheels from NRSD. So I think we, with the cooperation of the superintendent, which I think you saw this morning was sincere and widespread. We struggled, one of the reasons that we waited so long before trying to ramp things up a little bit is we recognize very much the sense of isolation that our seniors in particular can feel, and the importance of the senior center. And we have consistently, with Laurie's advice, with Jackie's, tried to balance out the social good of leaving these facilities open and the economic good of leaving these open versus the public health risk. But that has clearly come to the tipping point. And the governor's order of 25 people, we can either put somebody at the door, and when we get to 25, say, oops. Like you go to a store in the mall and no one more can come in until somebody else comes out. Just isn't practical in our opinion. So at this point, it appears the only option is complete closure across the board. However, as Jackie has said, we will take calls. If someone does have a sense of isolation, we will make those phone calls. We'll do everything that we can to try to mitigate that loss of activity, but we have to be practical about which side of the scale we act upon. And at this point, it has to be the public health side that we weigh in on.
Okay. And Selectman Griffiths has kind of a follow-up question about citizen meal delivery. whether you can get, can you get volunteers, kind of like a fire brigade, except for meals?
If someone has a food insecurity issue, I'm going to encourage them tomorrow afternoon when we put this press release out to contact the numbers that we give people. And while I very much appreciate the volunteerism effort here, we as a community, as an organization, I should say, have to be careful. This could transmit easily, and the whole point of this effort on the part of the state and the federal government is, unfortunately, to separate and isolate people. And so we're going to have to wait and see.
Right. Okay.
But certainly, if we can get these notes afterwards, we can make sure they're included in tomorrow's discussion.
Absolutely. Mm-hmm. I didn't have any other Q&A from online, but again, if this is a joint discussion before we make any kind of other declarations. Anything else?
Just,
Absolutely.
yeah, for asking if you can help out in things, a couple of things. And this was on several, the governors and several mayors' conferences, is if you have the desire, and you can, they are actively looking for blood donors. There's still gonna be people getting in accidents, unfortunately, and stuff, and they are short, because people are staying away. One of the false rumors that the Red Cross put out is they've seen on Facebook is, if you go to give blood, you will not get tested for corona. Apparently that had been put out, and that was on a follow-up to the governor's news conference. Also, if you're an animal person, or even if you're not, if you wanna help, don't forget the animal shelters. You can perhaps call, and if they need donations, from what I've seen, that's still plentiful at the stores, if you so desire to do that. And with regards to the food pantry, I would say call, because there are food pantries. It may not, the way I've seen people loading up at the grocery store, they may not need this week or next week, but I would say call either one, any food bank, and see if they are actively looking. And those are organizations that historically, they share. I mean, it's not like, oh, you come to Gardner, you don't live here. No, they don't tend to turn people around. So if you wanna help out and donate, if the Templeton one is all set, we'll call, say, one in Gardner or another community, and perhaps donate. And because they tend to share those different things. Those are a few of the things that I think if people are looking to try to help. And with regards to the grocery stores, I've been in many of them in the last few days, just the cycle that I shop. You go one place, the bread thing is empty. You go to another grocery store, and it's full. It's just the cycle, I think, of the stores and their deliveries. If you go today and you're looking for chicken and it's empty, try tomorrow or the next day, but just don't freak out. But most of the stores are generally have stuff. You may not get the exact thing you're looking for, but the food, the stuff is generally there. But it does go in cycles. You go in this store and the bread thing's empty. You go to the next store, it's full. The pasta's gone. You go to this store, the canned good and paper goods are empty. But the meat and the chicken is, so Hanford's, Price Shop, and go different places. You just have to shop around.
The distribution network isn't affected.
I think there's still, that was part of the governor's news conference at 4 o'clock, was they're slowly catching up, and they're trying to put out that, you don't need to hoard, you don't need to go fill up 2 baskets.
Yeah.
They have no plans so far to ban people from going to pharmacies or the grocery store, but it is taking a while to catch up.
If I can follow up on what Jeff said and what Laurie said earlier, there is no need to buy 2 years' worth of food. In fact, this is a great time to Google the phrase, what meals can I make with whatever you have left over, to look in your freezers and your pantries and buy those few items that you need to fill it in, knowing that there is a disruption in the food chain. And it's anything that you do to use your resources wisely so that as many resources are available as possible for the public at large is frankly something you can do to help your neighbors.
Quickly, right before we came, Stop and Shop, and I know we don't have one locally anymore, but they announced that they would be letting people of the age of 60 and over go in and shop at special hours earlier than others. I qualify for that tomorrow, so I'm all excited.
Happy birthday.
Thanks. But I think other shopping facilities will probably follow suit with that, just to help with that vulnerable population.
I think there's an overarching we're the victims of reaction right now.
Yes,
And
unfortunately.
like many American things, we wind up we're resilient, and we're able to figure out a way to get through a crisis. And in this one, it had different flavors to it, and we're seeing things that we had not seen before. Selectwoman Richard and I were talking before about, it was 10 years ago, it was avian flu or bird flu. It was different in the response. And I think that what we're seeing is just a different set of people, different set of factors, and we're a victim of our reaction. But what people can have, watching our emergency meeting this evening, is that we are reacting, and we do have processes that we can implement to help people out. Jeff, thank you very much. Did you have anything else?
Well, by summertime, toilet paper ought to be working cheap.
Yeah.
People
Hope you
will
bought
be
your
selling
stock.
Because,
Or the price of bidets will go up
Yeah.
dramatically.
one of the two.
You can get those on Amazon.
Unless there's any other questions, Mr. Chairman, the staff would respectfully ask that the Board of Selectmen adopt either the draft as you prepared it, or
Yep.
the draft with modification, a state of emergency effective 6 PM this evening, which would remain in effect until revoked. That gives the staff what we felt that I needed to have sufficient moral authority to proceed. Again, actions that quite frankly I could have taken on my own to some degree, but we thought it best to make sure that the community at large was on board. Should you take that action, I do have one other item I need to talk through with you, which is the reality of the budget and annual town meeting process.
Okay, within this emergency meeting or post-meeting?
Given that I think it's very much going to have impact, particularly on getting to a budget Saturday morning coming up. I
Okay.
did not cancel
All right, before
Saturday
we
as of this
adjourn.
point. So I'd like to, if you would, adopt the resolution as presented or as amended, and then give me a moment to update you all.
Okay. The first thing I'll do is I'll ask for any recommendations from the Board of Health.
We would also recommend to do the same, the state of emergency
Okay.
declaration. Thank you.
Do you want me to read? I'll read the whole thing. Anyone else feel like
Sorry,
it?
Mike, I didn't hear you.
Do you want me to read it?
Sure.
I make a motion to make a state of emergency declaration, whereas a sudden, generally unexpected occurrence or set of circumstances demanding immediate public action has arisen within the town of Templeton, namely an emergent threat to the public health and welfare posed by the 2019 novel coronavirus. Whereas the worldwide outbreak of COVID-19 and the effects of its extreme risk of person-to-person transmission throughout the United States, the Commonwealth, and the town of Templeton significantly affects the health and life of our people, as well as the economy, and is a disaster that impacts the health, security, and safety of the public. And the disease caused by the 2019 novel coronavirus, COVID-19, is a contagious and at times fatal respiratory disease. Whereas on March 19th, 2020, the World Health Organization characterized COVID-19 as a pandemic. Whereas on March 13th, 2020, the President of the United States declared the COVID-19 outbreak a national emergency. Whereas on March 10th, 2020, the Governor of the Commonwealth of Massachusetts declared a state of emergency to facilitate and expedite the use of Commonwealth resources and deployment of federal and interstate resources to protect persons from the impacts of the spread of COVID-19. Whereas as of March 14th, 2020, according to the World Health Organization, there are more than 142,000 confirmed cases of COVID-19 worldwide, and over 5,300 of those cases have resulted in a death. Whereas of March 15th, 2020, there are 45 confirmed cases and 119 presumptive positive cases of the COVID-19 in the Commonwealth. And whereas it is critical to take additional steps to prepare for, respond to, and mitigate the spread of COVID-19 to protect the health and welfare of the people of the town. Whereas the Chief Administrative Officer has determined that immediate public action is needed to prevent, minimize, or mitigate damage to the public health, safety, or general welfare of the people of Templeton or their property, which may otherwise result from COVID-19, and that taking the time required to comply with the various state and local procurement laws would endanger the health or safety of the people of or their property. Whereas the Board of Selectmen and Board of Health, in a joint emergency meeting held this evening, have determined that a state of emergency be declared in the town of Templeton. Now, therefore, we, the Board of Selectmen for the town of Templeton, Massachusetts, hereby declare that a state of emergency exists within the town of Templeton, effective at 1800 hours on March 16th, 2020. This declaration of emergency shall remain in effect until further notice is given by the undersigned or by the Templeton Board of Selectmen that the state of emergency no longer exists.
Second.
I have a motion and a second. Any further discussion? Hearing none on the motion to make a state of emergency declaration, how do you vote? Selectman Bennett,
Yes.
Selectwoman Griffiths,
Yes.
Selectwoman Haley,
Yes.
Selectwoman Richard,
Yes.
and I vote yes as well.
Thank you for your support. On
Very thorough.
the outfall of this, and following up on Ms. Griffith's earlier question, I want to be clear. The declaration of a state of emergency does not bring any cash flow to the community. You are fully responsible for each and every expense that we incur. That does not mean you won't get reimbursed in some proportion. Typically, it's 75% from the feds, 15% from the state, and 10% from the communities. And sometimes the state does a little bit more. And all departments, as of last week, were instructed, when I authorized additional overtime, to be sure to segregate any overtime or materiel purchases in a folder that they could easily lay their hands on, so that we wouldn't be sitting here in August saying, oh yeah, I think I did something in April. So everyone's on notice. We'll reinforce that. For those who wonder, number one, I think our budgets are mostly in good shape to absorb that. And should we be able to get the town meeting at a reasonable time, somewheres around when it's scheduled, I think we have sufficient time to backfill them for whatever excess we've had. And for anyone who wonders why I don't want to use the emergency reserve earlier in the year, kindly remember this event. Because in any given year, when you start using the reserve, in August or October, and something hits you like this in mid-March, and you would be sitting here saying, oh my Lord, why didn't we think of that? This is why you don't use the emergency reserve until such time as it may be a true, total, catastrophic event. Now, when will we get to town meeting? That's a very interesting question, because under Section 10A of Mass General Law, Chapter 39, you must schedule the town meeting as per your bylaw. And when it becomes close, the moderator, for reasons of weather, which we tend to have a little bit more further north, or public safety, can declare, without even being present, the meeting has been recessed and will reconvene to a date certain, but that date certain must be within 30 days. As Lori's laid out for you, nobody can tell you when you're going to be out the other end of this python. So, the governor has proposed legislation, House 4572, which would allow the moderator to declare, adjourn, recess the meeting for public health reasons as well. I frankly think the moderator could read this into public safety. To a time, date, and place certain. However, there's nothing in the legislation that allows you to set it other than what is in your local bylaws. One of the other nice things about this is it does provide for 1/12 budgets, should you not be able to get to and through town meeting by June 30. So that's an excellent thing. Neither the current legislation nor the proposed legislation addresses town elections. We are in the middle of that process. I have been working with your town clerk, Ms. Harris, who has been in contact with the chief counsel for the election division, Michelle Tassinari, and we have been trying, and they are talking about special legislation. Our hope would be that the select board would be allowed to override the local bylaw in an event such as this, to set a new election date, and then everything would work backwards from that. But at this point in time, if anyone is interested in running for any one of those offices, you have two options. Come in and get them before 4:30 tomorrow. Call Carol and ask her to mail them to you, or call Carol and make an appointment to come pick them up, because you still must pick them up on time, and I think that's the 26th of March. And while much of the world goes into cocooning, for lack of a better word, you still must return your papers on time. So for anybody out in the audience that has been thinking about a desire to run for an office, to serve the community in some capacity, and they're just they're not quite past it, and they think they have another couple days, please proceed in one of those manners, and we'll do our best to work with those folks, but we will be, along with councils across the state, other communities, talking with whoever we can talk with about some similar relief to 4572, my apologies. Finally, that brings us to the budget workshops. You are going, most likely, have to blow by the town bylaw date of when you will deliver the warrant to the advisory committee. Notwithstanding their desire to have it by a given date, I'm frankly, as I sit here today, pretty well convinced you're just gonna end up walking past it. And I need some sense of direction. I still think that much that's in the budget can be addressed just by, send us the questions and we'll get you the answers. And then we can try to do something down the line. But I will need a decision in the next couple of days whether to cancel Saturday, see what we can do on Monday, or whether we're just gonna do a paper review with questions. And then if there are questions we cannot readily answer that, or they're more philosophical in fashion, which will be the warrant. That one we're not gonna do with a paper review for sure. We can then arrange some one-on-ones or some more focused meetings as opposed to the, you know, more extended review that you were having on Saturday. So that is a quick outline of how cash flows, what I think our cash position is, how I think the election and town meeting process will come out at the other end, and a way forward to have a budget to present to the community on whatever date that is.
All right. Thank you, Mr. Terenzini. So we need to get back with you with some ideas on how to achieve, I think that we need to achieve Saturday, whether it be remotely or otherwise. But I don't want to be backed up. I don't want to, if we're improving our relationship with the advisory committee, certainly don't want to quote unquote walk past them with the budget process, especially if they're pledging to be willing participants again this year. I don't want that to happen.
We can certainly do that. After tonight, we will learn a little bit better. I think the big thing was having the telephone conference, getting that onto the phone. I don't know why we had trouble from several phones here today, getting through, trying several different numbers. That meeting will, however, be closed to the public. But we have sufficient room in here to handle the advisory committee, the select board, and bringing the department heads in one at a time.
Yeah, I'd like to take a look and see if there's anything, you know, how remote can we make it? How teleconference-ish can we make it? Because we do have the product, like you said, a lot of the questions should be being generated now. To look at that book fresh and cold on Saturday morning would be a disservice to how you act in this process. So if those, you know, in the advisory committee and us sitting here tonight, department heads, I'm sure, they prepared the budget. You know the budget. Adam, I know that you know the budget. You know what corrections that we need to make. But for the people that are responsible to hear that from the department heads and anyone's briefing on it, we need to have our A game way before a Saturday event could occur.
So then I would suggest that we will still do Saturday. We'll see what the work product using YouTube and the telephone conferencing was tomorrow. We'll try to sort out how we can get better speakerphone capacity. But I would still encourage select board members, and I will do this tomorrow with advisory. If you have a straightforward question, send it to us. We'll issue an addendum.
Yeah, I agree.
Because to the extent we can minimize the amount of time that we take on Saturday, or where we can spend them on, you know, something beyond what is whatever MPNO or, you know, whatever the abbreviations are. To the extent we can really spend those on weightier issues, that would be a better use of the department's time.
I certainly hear the rock and the hard place that we're up against, but I want to be able to, you know, I'm looking, like I said this morning in our meeting, I'm looking for opportunities, and if we're forced to socially distance ourselves and protect each other, then I think that we can try and leverage our technology as much as possible, rather than just laying a cell phone
And I
on the
think,
table.
Holly, if we can just add one more table over on that side, we can
Even
get
if we need
people
to do it.
separated out a little bit.
Yeah, let's have a discussion post, we've got a few more days to kind of talk through this, but I think we can get there.
That can work for us. We'll make that work.
If there's nothing additional this evening, I will entertain a motion to adjourn.
Massachusetts
I did have
Public
one
Health
quick
Network.
question on, is there a status or an update on us really reviewing, and this might be a little bit off the topic of this evening, but reviewing our bylaws and updating our bylaws, because we apparently have not in many years on certain bylaws that are gonna make it sticky for us in the near future.
Well,
I just was wondering if there was an update on that.
unless you're prepared,
It's never on
and I don't think
business
the
meeting.
community would be prepared.
Right.
Unless you're prepared to say that the town election will be held sometime between here and there, subject to the Board of Selectmen's call. And remember, we are in a partnership with Phillipston and do elections to the
We
school
talked about
district
this 4 years
at
ago.
the same
Yeah.
time. And you are prepared to say that the select board will call the annual town meeting somewhere between here and there. There's really nothing in the bylaws that you can do. I mean, this is pretty common. Most communities set the date of their annual election. They set the date, not the dates, but the day of the week for their annual town meetings, and they leave the fall town meeting to the flexibility of the select board based upon the flow of work. So, this is, I've been at this a couple years now, and this is the biggest event. I would say even, well,
I know.
even bigger than the Northeast blackout, which only lasted for 36 hours, and even bigger than the ice events of 2008, which lasted, it did last in some communities for, as much as 14 days, depending upon which utility. But you knew what was going on, and everyone had free movement, and you knew when it was gonna be over.
Right.
This is the biggest uncertain, unsettled state of affairs this country's probably been in since the Cuban Missile Crisis, and I don't think I'm exaggerating.
Well, we're live streamed, so I'll check for you. Carter, you're full, no, sorry.
That does show my age, though.
So, Mr. Chairman, our regular business meetings will be closed to the public? Are we gonna have regular business meetings?
This,
And if so, if they're closed to the public, how can we get public comment, or what, are we
Well,
gonna
I
have to
mean,
come up with a plan?
tonight, we're kind of proving, we're
Able to.
this is our beta test for how we can move forward through these things. I'm certainly committed, but I want to be able to make sure that we're complying with everything that we just told the public we were gonna do.
the intent is that, as of this evening, all buildings will be closed to the public. And yes, that means that your business meetings will be closed to the public.
And that
We
was,
will do our very best to live stream them if this experiment works. We have to make available, under the governor's executive order, comments. But unless you're willing to post a guard at the door and count the number of people that come in and tell everybody else they have to go away, no, it's just not feasible.
I think there was an alternative in that governor's executive order that tried to live stream, phone conference, but if it was an undue expense or it couldn't happen, then you get up minutes of the meeting as soon as possible, and
They have to be, it has to be a transcript, Jeff, it's not minutes.
but I mean, YouTube is up there usually pretty regularly, and that's a direct, I mean, as close to video conferencing as we can get. If we can go live, we can go live.
Yeah.
But the language is in there that if it's an undue expense or burden, you get it up as, it's like an emergency meeting, you
Yeah.
post the notice as soon as possible. So they gave you room, but I hope, Steve, this works
I think
better.
from any indication that, Sean's been giving me screenshots of the questions, which I wasn't sure how we were gonna handle that, and I actually think that went quite well, getting the questions and being able to be that reactive, but, thank you for that question. That was good. If there's nothing else, I'll entertain a motion to adjourn for this evening.
So moved.
And I will entertain a motion to adjourn. Say yes.
I have a motion and a second for adjourn. Any comments? All those in favor of adjourning, say aye.
We are adjourned. At 20:10 hours, and here's my text to stop the live feed. There is a 30-second lag, so anything you're saying right now is still being broadcast.
We were laughing, saying, oh, geez.
Fundraiser for,
I made a
know.
motion.
pantry.
I don't know who seconded. I didn't hear anyone second our motion.
I wouldn't do it.
Jeff did.
I wouldn't do it because
Oh, for this?
Said so
Yeah, that would be-
they're gonna feel
Jeff
guilty
said
driving past you. They're gonna feel uncomfortable
He was
stopping.
actually the
That's a
closest
lot
one
of
to you,
interaction.
Holly, and you didn't catch
volunteer.
that
Those out
second.
there on the
It was
phone, I'm gonna
very
go ahead and,
small.
let's see, I'm gonna make sure that
Having this
I'm,
conversation, but I'm telling my people we're not doing it, so.
remember to
How much
press
do they know
9
what it
again when the
is?
meeting is closed.
Well, I can't say that. I've done one in our time. This is something we're bringing back to try to get.
Run, get out of here before I
Hearing how the food
I
pantry
think I did
stocked
that
up, we were
right.
told.
All right, I'm gonna hang up.
they're doing.
And the other thing is, right
I went,
now,
I went shopping this
And
morning.
we are clear.
10 pounds
we
of
had the Last
hamburger
Supper
and
of
freezing
that,
stuff. He's,
that
well,
young
no,
lady's
he was.
house.
Hey,
He's
there's
used to having-
barns at
But the unemployment
clothing
isn't
ministry.
gonna give her tips,
Friggin'
and his
marrow.
We
Oh,
did
I
talk,
got-
so
yeah,
Sean and I did talk
I
before.
bought